When a doctor diagnoses dementia, there are so many things to talk about with the patient and their family. I'm Dr. Mandarin, here to help you live happily and healthily. This time, let's talk about those who have been diagnosed with dementia. And I'd like to explain which videos the family should watch. By watching this video, those who have been diagnosed with dementia and those who have had a loved one diagnosed with dementia will be able to understand in detail what we as doctors usually need to explain to patients and what we actually explain. I'll go over everything thoroughly, so please feel free to take notes or go back and rewatch parts of the video. Some parts may be tough, so feel free to listen casually or replay as needed. Please watch until the end. I usually work at a hospital, doing things like outpatient care, inpatient wards, and home visits, and I diagnose dementia quite often. As people are living longer and longer, dementia affects about 40% of people in their late 80s and as many as 60% in their 90s, so it's really not something that only affects others. When you or I are diagnosed with dementia in the future, doctors have to explain so many things. If I go through them one by one, the key points of caregiving for dementia are actually it becomes a heartbreaking situation. For example, they might accuse you of taking something, or they might wander around saying they have to go home. They might walk off somewhere, or sometimes they might get angry or even become violent. Why do people with dementia behave that way? There are also some tips on how to interact with people with dementia. I'll put links to past videos about that in the description. Another thing I want to talk about today is medication. There are medicines for dementia. These medicines can help slow down the progression of dementia a little. They might help improve the symptoms for a while. However, these medicines are not always something you can expect great results from, and there are people who should use them and people who might not need to. If you want to know more about that, or if you are a healthcare professional, I'll also put a video about that in the description. Please check it out. If you don't think you need to know that much detail, just watching today's video will be enough. So, what I want to talk about today is what kinds of things are effective in preventing the progression if someone is diagnosed with dementia. I'll also talk about when you need to apply for long-term care services, what to do about returning your driver's license, and how to manage things like money and medication. And finally, I'll talk about the course of dementia and your wishes. As dementia progresses, it becomes harder to understand your own condition. So, while dementia is still mild, it's important to talk about how you want things to be in the future and discuss those important points. So please watch until the end. Let's get started. The first thing to do after being diagnosed with dementia is prevention, right? What should you do to prevent dementia from progressing further? What is important for prevention? If we look at them one by one, talking with people, exercise, a balanced diet, and brain training. Well, these are obvious things, aren't they? Even though a doctor is talking about this on YouTube, I can only say these obvious things. That's because nothing else works, so please don't underestimate them. Dementia is, after all, a real disease, and it's not something that can be cured with treatment. There's nothing you can do that will definitely prevent dementia, but if you look closely, these are things that are important for everyone's health. So even when it comes to dementia, it's important to avoid reducing opportunities for conversations or exercise. That's why it's important to listen carefully to my next explanation about applying for long-term care services. Regarding brain training, it's mainly about working memory, like remembering something you just learned and recalling it again. There is data showing that training your memory like that can help slow the progression of dementia, so I'll put a link in the description about how to do brain training. Please check it out. So, if you've been diagnosed with dementia, the second thing you should do is apply for long-term care services. This is the most important thing. The reason it's so important is that it helps reduce the burden of caregiving. As dementia progresses, various symptoms can make things difficult for the family, and things the person used to be able to do become harder and harder. That's why you should prepare in advance by applying for long-term care services. When you apply for nursing care, what happens is that a care assessment will be conducted. An assessor will come to your home, for example. If hospitalized, your care assessment happens at the hospital. They'll ask various questions and determine what this person can and cannot do. Then, there's something called the primary doctor's opinion letter, which is a document the doctor writes after examining the patient. With that, they decide what level of long-term care support this person needs. There are 2 support required levels, 1 and 2, and 5 nursing care required levels, 1 to 5. Support required level 1 is for those needing minimal care, while nursing care required level 5 is the most intensive. Level 5 means the person needs the maximum amount of care. It's set up like a gradient, so what kind of services can you get with this long-term care insurance program? For example, adult daycare, helpers, assistive equipment, and home visit nursing are available. You've probably heard of adult daycare before. You visit that place during the day, eat meals, and return home. Bathing services are also available for those who struggle to bathe alone, making it easier for families. You can take a bath there and then go home. There's also this aspect. It also gives you opportunities for conversation and exercise. You can enjoy talking with friends around you. It also gives you a chance to move your body a little, so day services become pretty important. And as for helpers, to put it simply, they're kind of like a jack of all trades. They can go shopping with you and help out, cook meals with the groceries they bought and prepare food in advance, or clean the house for you. That's what helpers do. They help with all sorts of things like that. And assistive equipment is actually important too, because as dementia progresses, people naturally become less active. Their motivation decreases as well. When that happens, their legs and lower back get weaker, and there's a higher risk of falling. So for example, you might install handrails on the walls like this, or put up guardrails next to the bed. Also, as some people gradually become bedridden, you can rent a bed with a backrest that can be raised so they can eat meals while lying in bed. You can use those kinds of services, and if the condition becomes more severe, there are also services where a nurse will come to your home for home nursing care. If someone is bedridden and gets bed sores or redness needing care, a nurse can visit to treat it. If their condition is unstable, nurses can come several times a week to check things like blood pressure. Home rehabilitation brings services to you if needed and can be covered through the long-term care application. As mentioned, these all require long-term care insurance. When people ask Mandarin, they often say, "My family member probably has dementia," but they insist they're fine, so it's hard to get them to agree to a care assessment. Many struggle with this. I've made a video about tips for caregiving, and you can find it in the description below, so please check it out. Little by little, as the level of care needed increases like this, it's necessary to update the care assessment, and the things you need will keep increasing, so I think it's important to get long-term care insurance as early as possible. Here's the third thing you should do if you are diagnosed with dementia. I'll explain them together: driving, money, and medication management. Driving has become a social issue these days, especially with elderly drivers. As a doctor, how should we deal with this? And what does the law say about this? To explain it simply, as a basic rule, people age 75 and over are required to take a cognitive function test when renewing their driver's license. So if there is a certain level of suspicion of dementia at that point, the person is required to return their driver's license. If you pass that, you're okay for the time being. Well, you might take the test at 75 and pass it, but by the time you're around 79, there could be people who are starting to show signs of dementia or whose driving has become dangerous. In those cases, doctors can point it out. They might say something like, "Isn't it about time you considered giving up your license?" Even if the person doesn't do it, if it really seems dangerous for them to drive. If we think it's getting a bit dangerous, we can report it to the Public Safety Commission. Then they'll conduct a cognitive function test, and if the person fails, their license will be revoked. That's how the system works. Basically, when a doctor suggests it's time to give up your license, that's also the timing when you should probably stop driving. So I hope you'll actively consider giving up your license. And then in the case of a violation, basically whenever you commit various violations, you are required to take a cognitive function test, so you'll be screened in those situations as well. Also, managing medication and money becomes important. This is something that's crucial even from the early stages. Even people who can respond normally and seem fine sometimes start having trouble managing their medication without realizing it. When you leave medication management to the person themselves, it's a good idea to check if the remaining pills match up at least once. Sometimes, the number of pills doesn't match at all. One tip is to use a medication calendar. It's a big calendar with dates like 1, 2, 3, 4, 5, and so on. And for each date, there are small compartments. There are pockets for storing medication. Since you only need to take the medication for today's date, it's easier to remember. There are also ways to manage medication, like having a helper check if you've taken it. Also, bring your remaining medication to your outpatient appointment. This helps prevent forgetting to take your medication. And another thing that becomes difficult early on is managing money. It gets harder to handle things like paying bills. And there was a time when those it's me scams were really common, right? People can fall victim to scams like that, so it's important to limit the amount of money the person can use as early as possible. Also, when it comes to managing money, it's basically best not to let the person handle it themselves anymore. It's important to take those kinds of steps. Here's the fourth step if someone is diagnosed with dementia. It's about monitoring the progression and confirming their wishes. Let me explain the general progression of dementia. The purpose of this is to help you prepare yourself mentally to some extent, not to scare you, so please keep that in mind. Basically, dementia progresses gradually over about 10 years, but if you think about what might happen in the next 2 years or so, that's a good general guideline. There's no need to panic about becoming bedridden in 10 years. I didn't mention this earlier, but if you use the long-term care insurance system, you'll have a reliable care manager who can support and advise you. If you have any problems, all you need to do is call your care manager. I'm not trying to make you anxious, so keep that in mind. So, when we talk about dementia, how does it usually progress? It generally spans about 10 years. Of course, it depends on the type of dementia, but this is the case for Alzheimer's type dementia. In the case of Alzheimer's type dementia, it progresses over a period of about 10 years. There are some people who, after progressing just a little, spend the rest of their lives at that stage. In general though, at first, people tend to lose the ability to manage money, cook, or handle their medication. They also start having trouble organizing events or parties and things like that. This is mild dementia. These symptoms usually progress to moderate dementia over about 2 years. So what are the symptoms of moderate dementia? Generally, people lose track of the date and place. This is where they may not know what town they're in, or the date, like what month, what day, or even what year it is. They also start to have trouble choosing clothes appropriate for the season. These kinds of symptoms gradually appear. The progression of moderate dementia usually takes about 1.5 to 2 years, during which abilities slowly decline, and then gradually. When dementia becomes severe, what kind of symptoms appear? Well, there's something called ADL, which stands for basically, they gradually lose the ability to do essential daily activities like eating, using the toilet, or taking a bath. They may become reluctant to take baths. As dementia progresses, motivation and initiative decrease, and they spend more and more time doing nothing, just sitting idly. They also start having accidents with the toilet. They may forget to wipe themselves, and as it progresses further, they may become incontinent and frequently have accidents. After that, the number of words they speak also decreases. They also start having trouble forming sentences. This is a language impairment. Sometimes they can only say a few words or phrases. As it progresses further, they end up speaking only a word or two. They might respond with things like yeah or to express themselves, but it's not clear. And there are times when they can communicate and times when they can't. These kinds of things happen as the condition progresses. Eventually, they become bedridden and even lose the motivation to eat, gradually becoming weaker. This is the typical course of Alzheimer's type dementia. What's important here is their will. As the condition progresses, they lose the ability to understand their own illness. For example, they might not want to be kept alive by machines, or they might want to spend their final days at home. They eventually become unable to have those kinds of conversations, so it's not that you have to talk about these things while they're still in the early stages, it's just that it's difficult to have those conversations later on. Even if you can't have those conversations, by observing how that person has lived and having the family try to guess their wishes, various decisions can be made. But it's always better if you don't have to make those guesses, so little by little. It's not exactly a family meeting or an advanced care planning discussion, but it's important to confirm the person's wishes while they're still in the early stages. So what did you think? Please be sure to subscribe to the channel. If you enjoyed it, please give it a thumbs up. This helps YouTube share the video with those who need it, so I appreciate your support. Today, we talked about what to do if you are diagnosed with dementia, including a checklist of what we doctors do when diagnosing dementia, and I explained those details in depth. If you have any questions or concerns, please leave them in the comments section. See you next time.